Last Thursday, former President Bill Clinton was admitted to a New York hospital after complaining of chest pains. President Clinton, who has a history of cardiac issues dating back to his quadruple bypass surgery in 2004, had emergency surgery to alleviate a 90% blockage of the coronary artery. What does the future prognosis look like for President Clinton? Joining us from Montreal, Canada, is Dr. Christopher Magovern, cardiothoracic surgeon at Morristown Memorial Hospital. Dr. Magovern, thanks for being here with us.
2 minutes, the same number.
Tanya, delighted to be here.
So can you first walk us through what happened to President Clinton last Thursday that led up to his surgery?
Sure. Well, we all know he had quadruple bypass surgery 5 to 6 years ago, and he was clever enough and smart enough as a patient to recognize that something was wrong. He developed some symptoms of tightness in his chest, saw his doctor, and his cardiologist then put him through what is our best diagnostic test to study the blood flow to the heart, and that's called a coronary angiogram, or a cardiac catheterization. It's performed by a cardiologist in a catheterization lab, generally with very little anesthesia, and we've heard from President Clinton that he was awake during this procedure. A catheter is inserted into one of the arteries in the president's groin, and it was fed up to the heart, and dye was injected into the arteries of his heart as well as into the bypass grafts. And X-ray pictures were taken which showed us what the problem was.
And that's when they subsequently inserted the stent, the 2 stents?
That's right, Tanya. What they identified was that one of the 4 bypass grafts had closed. And then they changed gears. They went from what had been a diagnostic procedure to then what became a therapeutic procedure. And they advanced a similar catheter up to the level of the blockage. This catheter had a special balloon on the end of it, and they were able to expand the balloon at the level of the blockage to open the blockage. And in President Clinton's case, this balloon was covered with a stent, which is a metal scaffold. And as the balloon expanded, this stent expanded across the blockage and pressed up against the wall, propping the blockage open.
There have been some reports, I don't know how accurate they are, that Mr. Clinton had been suffering some chest discomfort for the past several months. Now, whether or not that's accurate, just how seriously should people take signals like chest pains, and what could they be signs of?
Well, they should take them very seriously, Tanya. And to his credit, he recognized the symptoms as a problem and sought medical attention. The classic symptoms are heaviness or tightness in the chest, a sense of breathlessness, not being able to breathe. Sometimes the discomfort, which most patients don't describe as pain, just a heaviness, can go up to the neck and down the arm. And anyone that has a history of coronary artery disease or anyone who's had previous heart surgery needs to be conscious of these symptoms.
Now, Doctor, a lot of people are curious. He did have this successful quadruple bypass surgery in 2004. And how then is it possible that he would need this procedure now? I mean, I know that he at some point did confess that he was not living the most healthily with the way that he ate and the rest of it, but he has sort of reformed his ways since then. So what would account for that?
Well, Tanya, that's really the question. That's a fantastic question, because you could argue that this man was entitled to the best health care America could provide him. He had an excellent operation, he had an excellent surgeon, and he took care of himself after the operation. But things progressed, and there are a couple of different reasons why he got into this sort of problem. One approach is to think of the fact that surgery is very delicate, it's very demanding, there is no room for error. Technical problems can occur, and if a technical problem had occurred, that could compromise blood flow. I think the likelihood of that being the case is exceedingly low, because technical problems, if they do occur, they usually manifest days, weeks, or months following the operation, not 5 to 6 years. So I think we could write that off. Another thing that we worry about is what we call progression of disease. When I sit down and I talk to my patients that I'm about to operate on that have coronary artery disease, I remind them that coronary artery disease is a chronic condition. Bypass surgery does not cure your problem. You have a genetic makeup that wants to continue to place deposits in the arteries and the blockages of your heart. So even if you do everything right, that can occur. Obviously, if you smoke, if you don't watch your weight, if your cholesterol is high, then things can progress. And the last thing, Tanya, is that the bypass grafts may not last forever. There is a certain incidence of what we call graft failure. And we use two types of arteries or veins to reconstruct the blood flow to the heart. We use an artery from behind the breastbone, and we use veins from the leg. And what we know is that 10 years after a bypass operation, the artery from behind the breastbone will be working 95% of the time. So that's our workhorse.
Right.
The vein that we use from the leg, in 10 years, only a third of the time will be perfect. A third of the time will have some blockage, and a third of the time will be closed completely. So at some point in time, these bypass grafts may wear out. Thank you so much, Dr. Magovern, as always, for joining us with such great information. And remember, follow all the developments on President Clinton's condition, and to learn more about heart issues, head to the health page at abcnews.com.